Hello, all. Welcome to the Center of Mental Health Advocacy, Research and Treatment Services, also called CMARTS. We appreciate you choosing us to support you in your mental health journey, and we are committed to helping you improve your well being. So, friends, in this video, we'll be discussing about psychosis. Psychosis is a condition that affects how people perceive and interpret reality. People with psychosis find it difficult to distinguish between what is real and what isn't. It can cause disorganized thinking, difficulty with problem solving, and social interactions. In short, it affects an individual's thoughts, emotions, and behavior. Therefore, treatment becomes essential. Psychosis presents range of symptoms, and they can be categorized into three broad categories: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms refer to the presence of behavior that wouldn't normally be there. The individuals hallucinate, where a person may see or hear things that aren't real, and delusions, which are strongly held false beliefs which persist despite evidence against it. These symptoms make it challenging for an individual to identify the reality. Negative symptoms involve a loss of normal behavior or abilities. A person may struggle to understand emotions either through facial expressions, gestures, or tones. They might withdraw socially, speaking less, meeting less, and avoiding altogether meeting people. There also is lack of motivation in doing things that they once enjoyed doing, and their self care is highly impacted. Then there are cognitive symptoms, which affect their thinking, problem solving, communication skills, and comprehension. Someone might have difficulty focusing, staying focused, concentrating. They may not be able to stay focused at a task or while having conversation with someone. Memory can also be affected, making it difficult for them to remember things. Disorganized thinking, very commonly seen, and speech are some of the other symptoms that are very commonly seen in psychosis. Their speech may seem incoherent or difficult to follow. What happens in psychosis is a normal stimuli. Things we would interpret it in a certain way are misprocessed by them due to chemical changes or irregular brain activities. A neutral event might suddenly seem very threatening or important or carry a meaning that actually isn't there, and some people are naturally more sensitive to these responses. For example, there are those who may even startle without watching a horror movie, while there are some who may feel scared uh, due to their past experiences. For example, someone who has been scratched by a cat may feel scared in mere presence of a cat around them. These differences in perception and interpretation can create thinking distortions, which are at the core of psychosis. Understanding these symptoms and how perception plays an important role can help us recognize the impact these events have on uh, in an individual suffering from psychosis. It's not only about listening things or seeing things differently, but it's about how the brain interprets things for them, which is completely normal for them and far more real for them. But it may not be for the rest of us. Studies have suggested that chemical imbalance in the brain, especially hyperactivity of dopaminergic neuron in the mesolimbic pathway, plays a significant role in this. The brain areas that are involved in psychosis are amygdala, uh, hippocampus, and prefrontal cortex. The hippocampus is responsible for processing memory, but in psychosis, it can distort experience, therefore leading to paranoia. uh, most of the time we find a lot of time we find people with psychosis find hidden meaning even in a neutral event, or may constantly keep feeling that they are being plotted against. Amygdala regulates emotions, and when it becomes overactive, it leads to every emotion being felt intensely, leading to emotional outbursts, making everyday situations overwhelming for them. Then there is prefrontal cortex, which is responsible for decision making and problem solving. But with psychosis, this region struggles to filter the intrusive thoughts and blurring the line between what is real and what is false belief. So, what causes psychosis? Psychosis appears to be a result of a complex combination of genetics, environmental influences, and chemistry, brain chemistry, uh, altogether. So, genetics, if a close family member, a parent, or a sibling has suffered psychosis, the chances are 10% more. Um, However, genes alone do not cause the condition. Changes in brain chemistry also play significant role, and also the imbalance in the dopamine and glutamate system causes psychosis, can lead to it, which affects thinking and perception in the ways that can lead to the illness. Environmental factors such as stress, trauma, prenatal conditions, use of drug are also linked to the illness. It doesn't happen overnight. Many people experience early signs like withdrawn behavior, difficulty in clear thinking, becoming more sensitive to stress. For some, especially those having genetic predisposition, a major stressor can lead to the condition. People with psychosis interpret their unusual thoughts and sensations in a different ways. Some may feel their experiences are their experiences can reveal hidden truth, and which can lead to delusional thoughts, further leading to isolation. The stronger these beliefs become, uh, it becomes more difficult to challenge them. So, we have spoken about symptoms of psychosis, we have spoken about causes. Let's see the treatment. When it comes to treatment, pharmacotherapy is the first line of treatment for psychosis. Antipsychotic medication results in significant reduction of positive symptoms, which is hallucinations and delusional ideas. However, like any other medication, even these medicines have their side effects. Some of the side effects are sedation, dry mouth, weight gain, low metabolism, uh, movement disorders. And while it's important to discuss these with the doctor treating the individual, as it can impact the quality of life that these individuals live. That being said, medication should never be stopped abruptly, or individuals cannot reduce or increase the dose unless and until said by the treating doctor. The medication needs to be supervised all the time. Psychosis can become a lifelong condition that usually begins in young adulthood or at in any other age later in life. The early years are more often intense, leading to major social and emotional challenges. Over time, with help of medication, symptoms may lessen, and many individuals may have phase of stability. With the right combination of medicine, therapy, and social support system, the individual becomes much more stable and functional, in this condition, even with the condition. Besides medication, therapy plays a crucial role in psychosis. Individual therapy helps developing coping skills and manage stress. Cognitive restructuring or remediation therapy focuses on helping them improve their focus, problem solving skills, attention, um, and helps, which in turn helps them improve their functionality, daily functions. And metacognitive retraining again helps people recognize and correct their thinking. Biases, thinking biases, and brings about awareness, thus reducing their symptoms. Behavioral activation plays a very important role here. Having a structured routine encourages them to get involved into various activities planned through the day. Having a structured day routine can make a huge difference and works well along with the other therapeutic interventions. It not only helps them improve their mood, but also helps them improve their social engagement. After all this, is preventing relapse possible? Yes, it is. Preventing a relapse is possible with early recognition of early signs and symptoms. It's important to pay attention to the early signs like social withdrawal, difficulty in thinking, being focused. These are some of the early signs which can prevent the relapse. Having said that, maintaining a healthy lifestyle is extremely important. Um, and also having a support group system, having being part of some of the support group systems have showed great results by helping individuals feel that they are not the only one, but they have others who are suffering with the same illness and can cope well. So, medication, while medications will help them reduce their positive symptoms, which is hallucinations and delusions, and at the same time, therapy and group support group systems and therapies, individual therapy and group therapy will help them overcome their negative symptoms and. Also, family therapy plays a very important role where even the family is made aware of the early signs and symptoms which they can keep a watch on, and about the medication, the side effects of the medication, etc. This information will also help the family members support the loved ones in a better way. So, friends, with the right treatment, support, and self care, people with psychosis can live a meaningful and fulfilling life. Psychosis does not define an individual, it's just part of their story. And with the right support, their story can be one of growth, resilience, and hope. If you or someone you know is suffering or struggling, remember you are not alone and help is always available. So, friends, with that, we come to an end. Thank you for watching patiently and take care of your mental health. Bye.